Good morning, everybody. Whew. We are almost done covering the material for your midterm. We have the knee lecture that you're going to watch on Monday, and then you have the hip muscles of the hip on Tuesday, and then that gives you Wednesday to study. You should be studying every day, right? But Wednesday, for any clarification, I'll make a clarification video for Wednesday, basically from feedback questions you guys send me today and tomorrow. And then hopefully you guys do real well on the test. Okay, well, I got the foo-foo going today. So today's knee lecture. So this is the knee, or as in Delcom we call it the KNES. The important thing to realize about the knee is that it is a modified hinge. So your elbow is a true hinge. Remember, this is not elbow, right? It's radioulnar joint. So the elbow can only do this and this. The knee, though, has an evolved patella floating in the quad tendon here. The elbow's patella is what we call an olecranon that's still attached to the long bone. So this would be the humerus. This would not be attached anymore to the tibia. And so it's free floating. So what that means is that when you flex the knee, you unlock the knee. I'm simplifying this, but you basically, when your knee is extended, it's locked into place. The condyles lock it into place. The collateral ligaments are real tight, kind of splitting it, and it doesn't allow rotation in the transverse plane. If your knee's rotating in anatomical position, seek medical help. But when you flex your knee, you unlock it, and it allows some rotation. I like to use kind of my fist to represent, you got your knuckles that kind of make little condyles. So when you're in anatomical position, the way those knuckles kind of interlock doesn't really allow a lot of transverse plane stuff. Well, when you unlock it, you kind of take them apart, and then it allows some rotation. So remember, your knee can rotate in its transverse plane when your knee is flexed. Why that's important is because I'm going to show you muscles that influence the knee in anatomical position. We're going to have muscles that pull in the direction of knee extension. We're going to have muscles that pull in the direction of knee flexion, obviously. Just imagine my knee up in the air. And then we're going to have medial crossing muscles. So this is a representation of your knee, right? It's my elbow, but it's a representation of my knee, my radioulnar joint. You could have medial crossing knee flexors that when you flex the knee, pull in the direction of internal rotation, and you have one big daddy lateral crossing knee muscle that's going to pull in the direction of external, internals, externals. So you're going to have knee flexors, knee extensors, and then you're going to have knee internal and knee external rotators, as I'm going to show you in a circle. So muscles of the knee. The knee joint, not only a modified hinge, but it's the most commonly injured articulation in the body because it's the coming together of two very long bones, right? The two longest kind of rigid links in the body. And so there's a lot of intersection of stresses that happen at your knee. From shifting your weight and changing direction, jumping, is just a lot of impact. Well, the force travels up the body, but because that force is amplified by distance, that's what torque is, right? So you have tremendous torques, you have tremendous rotational forces happening at the knee, okay? So remember, we're keeping everything as simple as possible. And definitely not silly. but we're going to keep everything as simple as possible. Function. What do muscles do? The knee flexors pull in the direction of knee flexion. Knee extensors pull in the direction of knee extension. Knee internal rotators, knee external rotator. Again, a reminder that muscles are not only motion influencers, but they're also joint stabilizers. So that's actually why females have a higher incidence of knee injuries than males, because of the importance of knee stabilization of specifically those knee flexor muscles. When you're jumping and all that stuff, right? Again, high torques involved. So those muscles used as knee stabilizers are of importance. And men typically, that's why think of it like this. Females are typically more flexible than males. Typically, not that there's not exceptions. And so the opposite of that, well, if men aren't as flexible, why? It's because our muscles are stiffer. They have more resting tone to them. They call it stiffness, but that's basically a summary of active and passive contractile pull force, right? So if men are less flexible because their muscles are stiffer, it makes sense that stiffness would have an advantage of maintaining joint stability. Okay, all right. I'm gonna mosey on over there for a second and fire up the computer, and we'll look at our knee circle, and then we'll look at the muscles of the knee. I'm gonna go turn off the light. All right, so let me first start off by reviewing the specific muscles that I'm going to be showing you today. Rectus femoris, vastus medialis, vastus intermedius, vastus lateralis, Sartorius, Popliteus, Gracilis, semimembranosus, semitendinosus, semimembranosus, biceps femoris, gastrocnemius, and I already said biceps femoris. Again, I'm seeing it in the computer reversed, so all of that sounds like Greek to me. I got to turn around, make sure I see what the word is. So, a lot of big words, a lot of syllables, but simple functions, very simple functions at the knee. Remember, utilize Google, I have photos that I included of the knee muscles, but they're black and white. They're standard photos. So some students will print these out and color them or use a highlighter. I guess highlighter would be good because you'd still see, kind of the muscle striations in there. But Google has colored photos. Some of them are actually similar of the photos that I use, except they're color versions. So you have creative freedom to see as fit. Let's look at the knee circle, though. The knee circle proper. Remember, this is a right knee. All of our appendicular circles are from the perspective of the right side. And we can do that because the left side is going to have the exact same muscles as the right side. So if you're analyzing left knee flexors as a group of muscles doing a job, you could still revert to a right-sided circle to list the knee flexors, because the ones you have on the right are the same ones you have on the left. Okay? Function, stretching, everything is the same. It's just a mirror of each other. Okay? So in anatomical position of note, we will not have any rotation circles. I know that sounds kind of confusing. Well, you said that some muscles rotate, but yet there's no rotation circles. It's because all of our circles are based off of anatomical position. Okay, so in anatomical position, you have muscles that pull in the direction of knee extension, and in anatomical position, you have muscles that pull in the direction of knee flexion. So what most students will do is make a note, or they will take a pencil or a colored pencil and circle or kind of box within a box the Sartorius, Gracilis, semimembranosus, semitendinosus, and Popliteus. Those are your knee internal rotators when your knee is flexed. And again, you're like, well, why in the world do I need, how often am I in open, with my foot off the ground and needing the internal, look like I'm milking a cow? And again, it's not so much that you need them to function like this. It's when you, specifically when you cut and plant. I talked about this in 310. When you cut and plant and you have that torque at the knee, if your knee didn't give a little, you'd rip apart those ligaments. So when you cut and plant, notice when you cut and plant, you don't do it with a straight leg. When you cut and plant to change direction, you flex your knee, thus unlocking your knee, thus allowing some rotation. But you don't want to have too much rotation, because again, you'd snap your knee like a chicken wing. So you need to have some, but not too much. So what's your insurance policy for not too much? Muscles. So several internal rotators preventing excessive external rotation. Okay, that's primarily why you have those several internal rotators, is to prevent hyper excessive external rotation of the knee when you cut and plant. Okay. All right. You notice the knee, kind of like with the elbow, very basic about bilateral axis. So the anterior crossing muscles are going to be our knee extensors. They're all on a box. That box is on the AP axis because the knee doesn't do frontal plane stuff. Then you have your knee flexors all in a box. That box is on the AP axis for the same reasons. Okay. So the knee is actually very simple. Pretty, very simple. Yep. I'll be right back. I'm going to go pull up the pictures of the muscles. All right. We are going to be seeing a lot of these muscles. I'll try to get on this side today. We're going to be seeing a lot of these muscles again for the hip flexor, because a lot of these knee crossing muscles cross the hip. So the first hip knee muscle we're going to talk about the anterior compartment, the front muscles. Most of the front muscles are knee extensors, but not necessarily all, because remember, it's not if a muscle lives in the front, it's where does it cross? Does it cross in the front? So this Sartorius is a great example of why we don't do muscle function based on location. It's it's location, but it's location of the cross, not location of the lip. So this is an anterior starting muscle. This Sartorius starts in the front, specifically anterior superior iliac spine of your pelvis, crosses the hip in the front. So that's going to be a hip flexor. It lives most of its life in the front, but if you notice, it spirals around. And this is hard to see because it's a two-dimensional picture with a three-dimensional concept. So as the Sartorius wraps itself around, it goes from the front to the back, and it crosses the knee in the back. I'll try to find a separate picture of it. So this is actually a knee flexor, not because it starts in the front, not because it lives in the front, it's because it crosses the knee posterior. Okay. Couple cool things about the Sartorius. It's the longest muscle in the body, a long rope-like, strap-like muscle, sometimes referred to as a tailor's muscle, because back in the day, people that sewed for hours and hours and hours, they would have their hips flexed, shortened, knees flexed, shortened. And the Sartorius has a small function of external rotation. It pulls in the direction of external rotation, but it's not one of your prime movers. So when you cross your leg, right? So if you cross your left over your right or your right over the left, you externally rotate. So this muscle is super short in a cross leg position. Well, what happens if you put your elbow flexors in a super short position, like when you're in a sling? That's why we don't sling much unless we absolutely have to. Because when you sling someone, right? When you sling someone, this muscle gets crunched together, and your muscle will actually eat itself up in series to reestablish a new resting length, a new resting tone. Muscle doesn't like to be on slack. It likes to have at least some tone to it. And you can imagine if you held yourself in a sling for a period of a long time, when you get out of that sling, that muscle is going to be very stiff. So it's the same thing with this Sartorius. People that would sew for hours and hours and hours would have that muscle in a sling. And then when they would get out of that sling, that muscle would be very tight, very stiff. And there would be some trickle up and trickle down problems with having a tight hip flexor like that, and other hip flexors as well. So Sartorius, knee flexor. This one in the front, the rectus femoris. It is a knee extensor. It's one of our quad muscles. Quad, rectus femoris, and then your three vasti muscles, sister muscles. So you got a vasti family, and then you have a rectus. Apple, banana, strawberry, sledgehammer. Why is the rectus called something different? Because it has a different function at a different joint. As I'm going to show you, the other vasti muscles only cross the knee. Rectus goes up into the hip, kind of like soleus and gastroc, right? Okay. So rectus femoris is a hip flexor. I'm going to get to that in the hip, but it is a knee extensor crossing the knee in the front. Okay. Rectus femoris. Here's a picture of your other vasti muscles. They are locationally based. What I mean by that is they're based on their location. The one that's more in the middle is your vastus medialis. The one more on the outside, vastus lateralis. And the one in the middle, vastus intermedius. Now the vastus intermedius is like the soleus to the rectus is gastroc. So the rectus kind of is more superficial. Intermedius is deep. Pulley system. Okay. Notice how these muscles don't go off up into the hip. Okay. The rectus crosses the hip in the front, attaches on the anterior inferior iliac spine. Three vastis and your rectus. That's your quad. Okay. They blend into a common quad tendon. That tendon passes through the patella. It doesn't end on the top and then start a new structure on the bottom. So for some people, that'll say like patella ligament and then they're like, it's a ligament because it goes bone to bone. Nah, dude, that patella is just floating inside the same rope that is the quad tendon. So how we differentiate it is location, location, location. Superior, we call it the quad tendon. Inferior, we call it the patella tendon. But it's a tendon, meaning that it's transferring force from muscle onto bone for the sake of movement, influence, and stability. Okay, so it's a tendon. You get itis in it, you get inflammation from it because specifically the work that it's doing influencing motion. Okay, that quad tendon turns into a patella tendon. Location, 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 and it inserts in the tibial tuberosity of the tibia. Pulling on the tibia, influencing knee motion. Location, location, location. We call different things, different structures, or we modify the names based on location all the time. Physiologists do this with blood plasma and interstitial fluid. It's the same substance, but if it's found in the vessels, like in your blood vessels, it's plasma. And if it's in the interstitium, right, it leaks out through the capillaries, and it's the same fluid, but interstitial fluid. So what's the difference between interstitial fluid and blood plasma? Location, location, location. What's the difference between a quad tendon and a patella tendon? Location, location, location. It's the same thing. Same material. All right. So, forgot a muscle. Go back. Okay, this muscle is called your gracilis. And the gracilis is the sledgehammer to your adductor group. You're going to have a group of adductors at the hip, which is the easiest muscles to remember, kind of like the supinator, right? Its function is implied. Adductor, what do you think it does? Pulls in the direction of adduction. But then you have this gracilis. So again, like the vasti rectus. Well, why did the rectus get this much different name? Because it crosses into and functions at a different joint. Same thing with the gracilis. Gracilis is a hip adductor, is kind of obviously pulling in that direction, but it is a knee flexor, crosses the knee posteriorly, pulls in the direction of knee flexion. If I had to give kind of an upper extremity version of the gracilis, it'd be like the triceps brachii long head, an adductor that functions at another joint distally. In the triceps case, it's the elbow. Obviously, it's not the same, but a similar kind of looking muscle that runs there. So gracilis, knee flexor. For you athletic trainers, you may see this structure and be familiar with it, the pes anserine. So again, it's kind of cool. The pes anserine, semi-tendinosus, gracilis, and sartorius. So this insertion is kind of anterior. So again, going to our sartorius, starts in the front, crosses the hip in the front, lives most of its life in the front, inserts kind of in the front, but yet it's a knee flexor. Why? Because when it gets to the knee joint, it crosses behind the bilateral axis. All right, I'm going to just touch on this just because there's a picture up here. So Q angle is short for quad angle, and it's a reference of how wide your hips are relative to your patella tendon, because your quad muscle is going to run along the femur. So if you have wide hips, you're going to have more of an angle of inclination of your femur, thus your quad is going to run more on that angle. And then when it crosses the knee, it's got to go to tibias that run parallel. So the angle of inclination of that femur to that tibia is what they call the Q angle. And there are some suggestions that Q angles could be associated with more or less injuries. But as I said, the biggest reason that we have more or less injuries at the knee is because of muscle stiffness or muscle tone. All right, how about we talk about some hamstrings? Oh, I got a southern accent. Some hamstrings. Hamstrings are, from my understanding, it's kind of one of those things you hear and you're like, well, that sounds true. I guess it's true. But these are the very taut, strong muscles that market people used to hang pigs up on the racks by the hamstrings because they were very strong, sturdy. They didn't snap with the weight of the pig. So hamstring muscles are obviously in the back. They cross the hip. When I do the hip lecture, I'm going to be specific about which ones cross or which heads cross. But at the knee, the importance is this is a posterior view. How do I know this? A few reasons. One, I don't see a patella tendon. I see the posterior condyles of the femur. That's the ischial tuberosity, which is the part of the pelvis that's in the back part. So these hamstrings cross the knee in the back. Your semimembranosus, the way I remember the membranosus is that it's the most medial. It has a medial meaty part, and then the tendinosus, and then the biceps two-headed femur muscle, biceps femoris or femoris. Okay. Now, when the knee is flexed, these kind of work. Let's see if I can use my little thing right here. So these muscles kind of work when the knee is flexed to rotate. So your hamstrings on the medial side, when your knee is flexed, are going to be internal rotation pullers. And then the biceps femoris inserts right here on that fibula head, and it's going to be a lateral or external. Let me keep it consistent. So this is a right leg, so I'll put it on my right side. Biceps femoris hamstring, external rotator, semimembranosus, semitendinosus hamstring, medial rotator. This is splinted, so it doesn't have a lot of rotation, so I kind of have to torque it to really show you the rotation. But I think you can visualize the inside knee flexors are going to try to spin this, and the outside knee flexor is going to try to spin like that. External, internal. All right, let me talk about a super cool muscle, a muscle that I kind of dig is the Popliteus muscle. It is a knee flexor and a knee internal rotator when the knee is flexed because of the way it pulls. So it's pulling the tibia medially when the knee is flexed. But the coolest function of the Popliteus as a knee flexor is that, again, when your knee is locked into place, a lot of your knee flexors kind of have more of a vertical pull, less of a, in other words, they don't really have a mechanical advantage to cause knee flexion when the knee is in anatomical position because of, there's a term called the screw home mechanism, but that's basically the mechanism that kind of locks the knee into place. Think about it like this too. When you are standing, usually you're at rest, right? When you're about to be active, you get in an athletic stance. Well, when you get in that athletic stance, your quads are working, doing a job preventing you from flexing over, right? So as a way to conserve energy, to have bone support bone, your knee gets in this locked position where it's not relying on your quads to maintain that position. Yeah, of course, if you relax all your muscles, you flop. But the point is that you are less needing to use knee muscles when you're locked into place because it's balanced and it's locked home, screwed home. So if it's screwed home, it makes sense. You got to have a key to unlock what is locked, and that's what the Popliteus is. It's the unlocker of the knee. Because it inserts on one of our femoral condyles, originates, and that condyle kind of protrudes out in the X, it gives it a mechanical advantage of pull that the other muscles don't have. In other words, this is a tough picture to see, but it has depth. It has a third dimension. That condyle comes out at you and gives that Popliteus a third dimension of depth to unlock the knee. And then once the knee is unlocked, then the quads can kick in to control the motion down, make you go up, that kind of stuff. Okay? So the Popliteus is kind of cool. Another way to look at it is when you were young, and I don't know if everybody did this, but we were mischievous youth, and we do this to our friends all the time in the playground. We'd come from behind them and kick them in the back of the knee, and their knees would buckle, right? You kick someone in the back of the knee and their knee buckles. That's what this does. Doesn't kick you, but it's the same concept. It unlocks your knee for you. Okay, so I'm going to review the muscle functions for you. Again, that's the so what. That's what you're going to need to make sure you know. Rectus femoris, knee extensor. Vastus medialis, knee extensor. Vastus intermedius, knee extensor. Vastus lateralis, oh yeah, knee extensor. Sartorius, knee flexor, internal rotator when the knee is flexed. Popliteus, knee flexor, knee internal rotator when the knee is flexed. Gracilis, knee flexor, internal rotator when the knee is flexed. semitendinous, knee flexor, knee internal rotator when the knee is flexed. Semimembranous, knee flexor, knee internal rotator when the knee is flexed. Gastrocnemius, knee flexor, knee flexor. And biceps femoris is a knee flexor, knee external rotator when the knee is flexed. Okay. Cool. Muscles of the knee. How would you stretch a knee extensor? Flex the knee. How would you stretch a knee flexor? Extend the knee. Kind of stuff. All right. Okay. So all we have left is hip functioning muscles. That'll be Tuesday's lecture. I welcome feedback and questions, clarifications, so that way Wednesday's lecture could be customized to what you guys need. Okay. All right, guys. You have a good Monday.